But it's been a long time since we've checked back in, and I thought this would be a good time with Obamacare back in the news. I'm talking about the Surgery Center of Oklahoma, and Dr. Keith Smith is the man there. How are you, doctor? Good to talk to you.
Hi, thanks again for having me.
It's really good to talk to you again. And like I said, we bring up you guys. I bet you guys come up once every month. I'm not kidding. In some example or something we're talking about. I'm like, yeah, but the Surgery Center of Oklahoma does it. So I'm really glad you're taking some time, doctor. I appreciate it.
Glad to be on.
For people who I got some deeper questions, bigger questions, but for people who have never heard of you before, what is the Surgery Center of Oklahoma?
Well, the Surgery Center of Oklahoma is an outpatient surgery center, and we do keep some patients overnight for procedures for which that's indicated. But we were started Dr. Steve Lonte and I started it in 1997, so almost 20 years ago, with really as an extension of our belief that the free market that governs every other industry in the United States should and could govern medical care delivery, even something as complex as surgical care delivery. So our mission was to have a free market facility, which means patients would know what things would cost before they got here, and that we would not price gouge people, that we would just take care of patients and be honest with our pricing. And that has been going on ever since we opened. But about 9 years ago, we decided to double down, and we put all of our prices on a website for everyone to view. And it's been a very interesting experience. We've learned a lot about how the healthcare scam in the United States works as a result of that. And frankly, we've spared countless individuals bankruptcy because our prices tend to be somewhere between an eighth and a tenth of what the so-called not-for-profit hospitals charge. And to put it in an even more clear perspective, the prices we came up with on our own and put on our website are less than what Medicaid pays these local hospitals who claim that those amounts are bankrupting them.
Wow.
So that's our story in a nutshell.
Yep. So a ton of questions. You say healthcare scam. There's a lot there. What do you mean?
Well, it was interesting. None of the insurance companies wanted to deal with us, even though we were known for our quality, and we took care of and still do take care of all the Division I athletes and Oklahoma City Thunder players. I'm pediatric trained, and anesthesia is our two of my other partners. So we've anesthetized, the children of just darn near everybody in the whole state now. And so we were very well known for our quality. We were darn sure cheaper than anybody else, and yet the insurance companies wanted nothing to do with us.
Why?
And we couldn't figure that out. We thought, wait a minute, in a free market, cheaper and better means your waiting room is full, but our waiting room is empty. We found the insurance companies actually went out of their way to bar entry to our facility for their so-called beneficiaries. And it wasn't until we put our prices online that we began to understand how that insurance end of the scam really worked. They still want nothing to do with us, even with our prices online, and here's why. Insurance companies really don't care how much the medical care costs. They're in the business of selling discounts. If medical care costs more than the insurance company would like, they just raise premiums the next year. So that sounds totally counterintuitive. You would think, okay, they collect premiums, they pay claims, and the difference is what they keep. It's more complicated. What they do is they take a $100,000 bill from a hospital, they discount it down to some amount, let's say $20,000, and then they ride into the office of the employer group that bought that policy and says, we just wrote in our white horse, saved you $80,000, and per the terms of our agreement, we are due some of that savings, some percentage of that savings. It's usually 20-30%. So when you think through that, you realize the insurance companies don't want a $3,740 bill for a knee arthroscopy on my website. What they really want is a $50,000 bill so that they can maximize their revenue from this shared savings scam.
Whoa.
And that's exactly why. And they don't they don't want anything to do with my fair prices because it denies them that opportunity.
All right, so they want the $50,000 bill. So I'm just going to repeat this so I get this right. They want the $50,000 bill from the hospital so they can go to the workplace and say, we talked the bill down to $3,000.
Yes.
Aren't we great? But you're going to have to pay for, well, let's see, we saved you $40,000. So I don't know. Why don't you pay us $10,000?
Yes. They pay, so they ask to be paid, and they contract to be paid for that discounting service. And that's where they make a lot of their money. And you think, well, these poor hospitals, no. The hospital throws this $100,000 bill out partly because they started at $50,000, but the insurance company said, "Can you do a brother a favor and make it $100,000?" Then the hospital throws out this meaningless $100,000 bill, glad to accept $20,000. To make it even simpler, let's say they charge $100 for an aspirin. That's not uncommon, by the way. And the insurance company pays $5. Well, the hospital says we've lost $95. Never mind, they paid a penny for the aspirin or less. But the hospital will claim that they lost $95 when they really didn't. And all that red ink helps them maintain the fiction of their not-for-profit status.
Wow.
And so they don't pay tax through this scam. But even worse, they add up all of these losses, call it uncompensated care, kick that to Washington, D.C., and then they get a kickback to the extent that they claim these losses. So it's like a reverse Enron, where Enron said they actually increased their revenue by overstating their gains. The hospitals make more money by overstating their losses.
Wow.
So
what's the kickback they get? What I mean, it's stunning what you just said here. What did they get by going to DC and saying we lost a ton of money this year?
Well, it varies. It depends on how much they say they lost. But if people want to look further into that, the kickback comes in the form of something called a disproportionate share hospital payment, or DISH, DSH. And it's a complete scam, and it actually it makes the hospitals inclined to generate even more insane bills so that the losses they can claim just get higher and higher.
Now, in the meantime, let's say someone doesn't have insurance. They go to the hospital and they get slammed with a $100,000 bill, which will bankrupt them, but it's not really $100,000.
No. Sometimes the hospitals will charge that and they'll actually get it. And they go, they're just go popping champagne corks for that. But many times they don't collect it, but they don't care, because even if they don't get paid by the patient, they're going to be paid this sort of rebate under the table thing from the federal government. So
the dish.
I always remind people, the hospitals, the insurance companies, all the folks in corporate healthcare, they are just scamming everybody, but none of this would be possible without the enabling federal government. So, it's like a bank robbery, except that, the government has armed these thieves and they're driving the getaway car. So the source of all of these problems is in Washington, D.C. These cronies are just taking advantage of these favors that they've paid very dearly for.
We're talking with Dr. Keith Smith from the Surgery Center of Oklahoma, a free market surgery center, puts their prices up front. So why does the federal government enable? Because you mentioned the dish, right? But do they do anything else that jacks this whole thing up?
Well, yes. I mean, they pay, for instance, physicians who are hospital employees, their services are paid at a higher rate than if a physician performs the very same service who is independent and not hospital employed. This has served to really destroy the practices of many private practice doctors. The Washington, D.C. has forbidden physicians from building or owning and controlling their own facilities to compete with these price gouging hospitals. And that started years ago with Pete Stark, and they're known as the Stark laws because, these greedy doctors, they're going to kick all this money and self-refer. Well, my gosh, if physicians can't own facilities, why in the world can facilities own physicians? When you talk about a conflict of interest.
So
the Washington, DC is just like an auction house, and they auction off our liberty every day, and the hospitals have a lot of money, and the insurance carriers obviously do, and the other players in corporate healthcare, and they pay very dearly for these advantages and favors, and then they take advantage of them, and you and I are the victims of it. Yeah. Everybody is.
Sure. So let's talk a couple solutions here, right? So you must be super frustrated whenever you hear any of this conversation about Obamacare and the repealing of Obamacare and what do we replace it with and all this stuff. Because I'm guessing from your perspective, they are so far off from the solution.
Well, they're the source of the problem. The idea that a solution could come from that swamp that caused all of these problems, the only solution that DC could play a positive part in is repealing every single thing that they have done pertaining to healthcare, because every law that they've passed has been for the purpose of serving the cronies who ask for the favor. So they really need to just start repealing everything, and they shouldn't stop with Obamacare, and that way a real free market where anyone who wants to start a hospital, anybody that wants to start a surgery center, or anybody that wants to put an MRI unit in, they can say, here is what I do, here is what we charge, here is why we think you ought to come here. We are better, we think, than our competitors, and we are willing to compete and get out there and try to satisfy the customers instead of play in this sort of cartel soup where people pay for admission and then they get shaken down once in a while. It's just a mess.
Let's play devil's advocate. Dr. Smith, healthcare is unique. You just described a great system for selling televisions, doctor, but not healthcare. Healthcare is too important and too different from other things to operate in a free market unregulated.
Healthcare is too important to entrust to the entity, the federal government, that screws everything up. The free market was at work until the government got involved. I've seen the bill for my birth. I'm 56 years old, and it was $125. And my dad was mad as a hornet. He told me at the time he thought he was completely ripped off. So healthcare was very affordable, very accessible, even for people that didn't have insurance. What changed was when the federal government got involved, and Medicare was one of the big distortions, and nobody wanted anything to do with Medicare.
So why did it start? Because that's the assumption. People think like, oh, well, if it started, it had to be for a reason.
No, it started because there was another law under Truman passed called the Hill-Burton Act, which put all these community hospitals and basically socialized hospital care all over the country. And then once these facilities were in operation, they wanted to plug directly into the taxpayer trough. They didn't want to have to collect from patients. So then you have a government program that funnels money to these government hospitals. So that's why Medicare came about.
Wow.
Keep in mind, no one wanted anything to do with Medicare. So in Medicare, when they started it, they knew that. So they guaranteed 100% of anyone's bill. Well, guess what happened to all of the charges? It's not rocket science. When, in order to get everybody involved, the federal government said, we'll pay 100% of your bill. Well, that was the beginning of the incredible price inflation, and it was all because of a federal intervention.
What is it going to take, Doc? This is my last question for you, because I'm sure you got to go to work. What is it going to take to change people's perception of healthcare, maybe when it relates to anything you want to go with, but the fact that we should know what it costs, like we're so used to this, right? And people lose their imagination on what it should look like. So how do we socially, culturally get back to what it should be? Forget about politics of it, social aspects.
Well, I would encourage everyone to familiarize themselves with the very easy to navigate website that we have with the Free Market Medical Association, the umbrella under which all the like-minded free market, not just providers, but buyers. The buyers and sellers of healthcare are gathering under the umbrella of the association of the Free Market Medical Association. And to really understand that it really is a willing buyer and a willing seller in healthcare will render prices just like you see on our website. And I would encourage your listeners, if they need to have a surgery, print out the prices on my website and take them to the hospital and say, step up, or I'm going to fly to Oklahoma City, or I'm going to go to Torrance, California, to Ocean Surgery Center, or I'm going to go to see Bill Grant at Monticello Surgery Center in Charlottesville, Virginia. I mean, we're all over the country now. So all of these options, I think, are going to make the change that you mentioned.
Really good. Dr. Keith Smith, wonderful to talk to you, sir. Thank you for giving us a couple minutes of your time, and I hope we can check back again.
Thanks for having me.
Thank you, sir. Keep up the wonderful work. There you have it. 1-800-760-KFMB. Have you ever heard that stuff before about the insurance companies and the way that collusion works? Unbelievable. 1-800, well, totally believable. 1-800-760-KFMB. We'll take your calls next. AM 760 Talk and Breaking News. Jim Charbet with the headlines. What do we got, Jim?